Are you one of those ladies who is suffering from a repeated urinary tract infection? Are you one of them who has burning sensation while passing urine, frequent visits to the washroom, urgency so that you can't control and you have the fear of leaking on the way to the washroom? Do you have difficulty in controlling the bladder at night time? Do you have bedwetting? Do you suffer from difficulty in emptying the bladder fully? Do you have a sensation of something coming down the vagina and not able to empty your bladder or bowel? Do you have any problems related to previous surgery, such as removal of uterus or radiation in the past for some other problem which is presenting as bladder issues? You need to see a urogynecologist. I am Dr. Meera Raghavan, consultant urogynecologist and robotic surgeon from Apollo Hospitals, Chennai, who is going to take you through every single symptom out there which troubles the bladder and the bowel in women particularly. Recurrent urinary tract infection is the commonest infection in women. Nearly 40% of the women suffer from it, and the main symptoms are frequent visits to the washroom, an urgent sensation to rush to the washroom, and pain and burning sensation. If it happens at least 3 times in 6 months' time, that is called recurrent urinary tract infection. This happens particularly in women because of the close proximity of the genital passage and the urinary passage to the back passage as well, and there is cross-contamination. So the most important myth I would like to clarify for women out there is urinary tract infection is not contagious. It doesn't come from using public toilets or a washroom which somebody else uses. It doesn't come from the outside. It is because of abnormal growth of unfriendly bacteria in your own system, which gets up the genital passage into the bladder and sometimes into the kidney, causing urinary tract infection. How to avoid and prevent these infections? The most important is intake of water. Each person should take water at least 3 liters to avoid urinary tract infection. Avoid excess caffeinated drinks because they make the bladder active and go multiple times to the washroom but leave you dehydrated. Also increase your probiotic intake, which is like your buttermilk, kefir, your kimchi and kombucha, which have good bacteria in them, which keep the balance right in your system and avoid urinary tract infection. One thing I would like women not to do is excessive washing and perineal hygiene. If you do overt washing and excessive perineal hygiene, this tends to wash away all the friendly bacteria from that area and thereby causes fungal growth and predisposes to urinary tract infection. But adequate hygiene has to be maintained. Who are at risk for developing this urinary tract infection? Women who practice excessive perineal hygiene, who have multiple sexual partners, patients who do not take adequate amount of water, patients who are dehydrated, who do not frequently visit the washroom but postpone the washroom visit by more than 6 to 8 hours, and women who are diabetic, who are obese, and who have had cancer surgeries or treatment of the pelvis for previous cancer in the form of irradiation. They are all predisposed to developing urinary tract infection. This is easily treatable and can be prevented by intake of probiotics and maintaining whatever tips I have given you in terms of lifestyle modification. Moving on to the next set of symptoms which I mentioned earlier. Frequent visits to the washroom, urgency, lack of control, the fear of having a leak while going to the washroom or even before reaching the washroom at an appropriate time, bedwetting, frequent visits in the night time. All these put together form what is known as overactive bladder. The bladder acts too much than what is required and sends the strong signal of contraction, thereby the woman does not feel the capability to hold even before she feels it's appropriate to empty her bladder. So what does this cause? Frequent visits, which is learned habit because they don't want the bladder to get full, or even before the bladder gets full, there's a strong sense of urgency, they leak even before they reach the washroom. and they have frequent visits in the night time, and bedwetting as well. Now, bedwetting is not something to be taken lightly, especially both in children and elderly patients. Children, maybe bedwetting is a sign of worm infestation, and that can be easily treated. The other causes could be neurological problems like epilepsy, where appropriate consultation and treatment can cure the bedwetting. In others, it could be deep psychological trauma like bullying in school, sexual abuse, or domestic abuse as well in children. So watch out for these symptoms. Try to spend more time and find out what's exactly happening to these children and seek a specialist consultation if bedwetting continues beyond the age of 5, as this can be completely cured. In elderly, the bedwetting is due to a different problem. When there is bedwetting, we always look for what is called obstructive sleep apnea. This classically happens in patients who are short-statured, have a very short neck, are obese, and have blood pressure problem. Why does this happen? When these body habitus are present, they tend to have snoring. And snoring is not a symptom or sign of good sleep or sound sleep. Snoring, in fact, affects the quality of sleep. What happens during snoring is the tongue falls back and the patient is not able to oxygenate the brain very well. When the supply of oxygen to the brain gets cut off or is compromised, the bladder center, or the head office if I may say, loses control of the bladder and there is a bedwetting accident. So snoring compromises brain supply of oxygen, thereby leading to multiple visits to the washroom in the night and bedwetting. So now you understand why I said bedwetting is not a symptom to be ignored like snoring, because they both have connection, because that it means that the brain is not receiving enough oxygen during sleep. So we evaluate these patients for sleep study and find out if they have what is called obstructive sleep apnea. Temporarily, we put them on medications which can control this, and while we find a positive result of the study, we put them on the CPAP machine, and this completely gets rid of the bedwetting issue. Overactive bladder can be easily treated by lifestyle management, avoiding coffee, tea, having correct amount of fluid, avoiding fluids after 9 p.m. before going to bed, maintaining a regular trained schedule for emptying the bladder every 3 hours, weight reduction and weight optimization, and medications tend to improve most of the symptoms of overactive bladder. If they are refractory to medications, we can inject botulinum toxin, a small chemical which can be injected via the endoscope into the bladder, and this can relax the bladder efficiently and reduces the incontinence as well as the leakage. This is a day case procedure and is available to reduce the embarrassment which comes along with the overactive bladder and these accidents which can happen unaware as well. So these are the various advances which are available to treat this particular condition called urinary incontinence, especially due to overactive bladder.